Hi, I'm Dr. Shanny. It's a pleasure to meet you. So, I was just looking at your chart here, and is this your first time here at our clinic? It is? Wonderful. Okay. Do you mind me asking how you heard about us? Mm, a referral? Okay, good. Good. Now, before we go ahead and get started on our exam, I'd like to just verify I'm speaking with the correct patient. So, could you just verify your last name for me? Wonderful. Okay. So, I saw here that you came in today for a cranial nerve exam. Is that correct? All right. This is just going to involve me doing a few different tests to take a look at the nerves in your face and your neck. All right. Wonderful. If you have any questions at any point, don't hesitate to stop me and ask, okay? I'll do my best to answer them. Good. All right. So, I'm just going to get a few more pieces of information from you and then we'll go ahead and get started. So, I see the nurse went ahead and got your height and your weight, so that's good. I just would like to verify your age and date of birth. Okay. And have you had a cranial nerve exam in the past? You have. Okay. So you're familiar with how this works. Perfect. Makes my job easier. Okay. And what is your current diet like? Okay. So it doesn't sound like it's too much of a concern. Are you drinking enough water, staying hydrated? Okay. I would like to see you drinking a little bit more per day, about 32 ounces, all right? I know it can seem kind of hard, but just think about like 4 water bottles worth, okay? And how is your exercise? All right, it's about moderate. Okay, it's not too bad. And do you do any drinking or smoking recreationally? Okay, occasionally. And how about any recreational drugs? Okay, no, good. It may seem like a silly question, but we need to ask. So, are you currently taking any prescription drugs, vitamins? Okay. And how often are you taking those? Okay. Do you have any past medical issues, problems, surgeries? Okay. Wonderful. And do you wear any glasses or contacts? Okay. Any allergies that I should be aware of, such as like latex or maybe any allergies to any prescriptions? Okay. And are you currently experiencing any pain that you want to let me know of? Okay. And how long has that been going on? Okay. Any changes with like work or stress levels? Okay. And do you have any changes in your sense of smell or sight? Okay. Well, very good. That should be all I need for now. So, I'm just going to set down my clipboard here. And I'm going to start by sanitizing my hands. Now, you said you didn't have any allergies to latex, right? Okay. Good. Just to keep things sanitary, I'm going to go ahead and put on some gloves and we'll get started with some basic checks such as like your temperature, your heart rate, lungs, blood pressure. Okay? All right. Sit tight. I'll be back in one moment. Okay. So, we're going to go ahead and start with your temperature. Have you been sick recently or are you feeling ill? No. Okay. So I have a forehead thermometer here. I'm just going to hold it about an inch away from the center of your forehead and get your temperature. Alright, hold still for me. I do have to get a little close. I hope that's okay. Okay, here we go. Good. Alright, 98.7, so everything is good there. Next, I'm going to go ahead and get your heart rate. So, I'm sure you've seen one of these before, right? Yeah. I'm just going to go ahead and turn it on and place it on your finger like so, and it's going to give me your heart rate, okay? All right. Let me just see your hand here. Okay. And that should take about 10 seconds, so we'll just wait for a moment. 3, 4, 5, 6, 7, 8, 9, 10. Very good. Great. Okay. So, it was just about 86, so you're all good there. Next, I'd like to just listen to your lungs real quick. Is that all right? Good. So, do you mind picking up your shirt for me a little bit? Okay. I know it can be a little cold. All right. Just going to place this here, and I would like you to breathe in through your nose and out through your mouth. Exactly. And again. You're doing great. All right. Your lungs sound fine, so nothing to worry about there. Next, I'd like to just get your blood pressure, so you don't mind rolling up your sleeve for me. Okay. Yeah, we're all set. And your blood pressure looks good. About 120 over 86, so not bad. Okay. I'm just going to write down those numbers so that I don't forget. So we had a temperature of 98.7, heart rate about 86, blood pressure 20 over 86, good, and lungs sounded great. Okay. So far everything seems actually really perfect. You seem quite healthy. Okay. I'm going to go ahead and start here with your eyes. We're going to get into the cranial nerve exam. Now, we're going to start with your sense of sight, and we'll move on to your sense of smell and then taste, then touch, and then we'll end with your sense of hearing, okay? All right. Now, are you noticing any issues with any of your senses? Mm-hmm. Okay. And how long has that been going on? Okay, but it's gotten better. All right. Good to hear. So we're going to start with my pen light right here. Now it is a little bright, so it might cause a little bit of discomfort. But if you're at any point ever uncomfortable, you just let me know, okay? Alright. Now I'm going to start by looking into your eyes and making sure they're dilating properly. So try not to move your head, neck, or shoulders, and just look right here at my nose. Okay? Very good. Here we go. Okay. Good. Other eye. Good. Okay. Now I'm just going to hold my hand up here and I'm going to swing the light from eye to eye. Okay. Good. Now we're going to do a little bit of a fun one. Go ahead and continue to keep your head, neck, shoulders, and body still. And I just want you to follow my light with your eyes, okay? Okay, here we go. Good. You're doing great. Almost done. Great job. Okay. So, next I'm going to hold my hands up over here and we're going to be testing your peripherals. So, I'm going to hold up a number and you just tell me what number and what hand is up and we'll go from there, okay? Alright, here we go. 2, good. 4, 5, 1, very good. 3, correct, alright. 1, 3, 4, 5, very good. Alright, another test for your peripherals. I'm just going to move my fingers away from your face and you tell me when you can't see them anymore. Okay? Alright, here we go. Good. 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 Great. You're doing an excellent job. So we just have 2 more eye exams and then we're all set and going to move on to your next sense. So, here I have my eye chart. And I just want you to read the letters that I point to, okay? Alright. E, correct. T, C, P, this one, E, D, and this one, C, and this one right here, F, and this little one down here, P, and this one right here. I know this one is a little tricky. T, excellent job. Okay, very good. Alright. Lastly, I would just like to test your sight and your color blindness. I have this color blindness chart right here. And just tell me what number you see here. 8. This one is a little hard, but can you see what's in here? 6. And how about this one? 20. And that one? 3. The middle one here. 15. 71. Down here. 57. 5. 42. Excellent job. Great. Well, it seems like your sense of sight is working properly. No concerns or anything that I saw. Okay. Next, I'd like to move on to your sense of smell. So I'm just going to grab a couple vials here with different scents. I'll be right back. Alright, thank you for waiting. I have a few different bottles here of different aromas or fragrances. And I'm just going to be spraying them on this tongue depressor here. And I'm going to hold it up to your nose and I just want you to smell and let me know what it is that you think you can smell, okay? Alright. So I'm going to have you close your eyes for me. Great. going to give this a little spray here. Okay. Go ahead and breathe in. And tell me, what is it that you smell? Vanilla. Great, great. Okay. Oh, yeah, if you don't mind, just keep your eyes shut. I'm going to grab the second one here. We have 3 different scents, so this is our second one. Just give it a little shake. Okay. Let that dry. And breathe in for me. And what is this one? Mint. Correct. Very good. Yeah, like a peppermint. Alright. We have one more. So let me just shake it up here. Okay. Alright. And what is this last one for me? Correct. This one is lemon. Great job. Alright. Now, if you don't mind, I'm just going to feel around your face here. Okay. And just feeling down at the bridge of your nose. Okay. And you're not experiencing any tenderness or anything I should know about. Okay. Very good. I'm just going to take a quick look inside your nose here. So, hold still for me. Good. Alright. Everything looks perfect. So we're going to go ahead and move on to your sense of taste. I'd like to start by taking a look in your mouth here. So if you don't mind opening up, sticking out your tongue flat and say, ah, for me. Okay. Just real quick. Yeah, these things are no fun. I have a bad gag reflex, so I understand. Alright. Now for this, we also have 3 different tastes for you to try. I have these little vials with a little dropper, so I'll have you stick out your tongue. I'll place a couple drops on it and you tell me what it is you're tasting. Okay? Very good. Okay. Yes, close your eyes for me again if you don't mind. That way you can't read what's on the bottle. Alright. Here is the first one. Okay. And let that just kind of coat your tongue. And tell me what it is you're tasting. Banana, correct, correct. Okay. Let me grab the second one here. Just going to shake it up. Okay. Okay. Stick out your tongue for me, and I'll just place a couple drops here, and let me know what it is you're tasting. It is bitter, correct? Coffee, yes. Alright, we have one last one. So, open this up here. Alright, last one. Very good. What do you taste? Chocolate, correct? Well, you're doing a great job. Alright, let me just write down your results. So, eye exam went well. No issues or complications. Sense of smell was good. And passed your taste portion. Okay. Next, we're going to go ahead and move on to your sense of touch. So, I have some Q-tips right here. Just going to open these up here. I have a sharp point here. Don't worry, it won't hurt you. Just needed something to compare and contrast. Now, how this is going to work, I'm going to have you close your eyes for me, okay? And I'm just going to touch different parts of your face. And I just want you to tell me if the soft end or the sharp end is touching you and where at on your face. Okay? Alright. You don't have any questions so far? Alright, let's get started then. Eyes closed. Very good. Here we go. Forehead soft, correct. Cheek soft. Chin soft. Nose sharp. Cheek sharp. Chin sharp. Forehead soft. Nose soft. Cheek sharp. Yes, other cheek sharp. Nose soft. Chin soft. Cheek soft. Forehead sharp. Very good. Okay. I'm just going to kind of feel around your face and your neck, so hold still for me. And do you mind just swallowing for me? Good, and again. Good, just making sure everything is working properly. Okay. Very good. Okay. Can you smile real big for me? Good. And frown. Excellent. And kissy face. Good. Puff out your cheeks. Great. Okay. That looks good. Now, I'm going to have you shrug your shoulders up and I'm going to push down on them and you try not to let me push your shoulders down, okay? Alright, here we go. Great. Okay. Now I'm going to place my hands on your head and neck and you try not to let me turn your head, okay? Great, okay. Very good. Now, did you have any pain or discomfort during any of those exams? No? Okay. You're doing a great job. Yes, I'm not noticing any signs of concerns. No, you seem to be in great physical condition. Okay. Lastly, we're just going to take a look at your hearing, okay? So I have a different light right here. And I'm just going to step around to the side and take a look in your ears real quick. Okay? Very good. Here we go. Starting with this ear here. Okay. Everything looks good. I don't see any issues. There's not much buildup. Great. Okay. The other side. Okay. Again, no buildup. Everything looks great. Very good. Okay. So we're going to start our hearing portion. I'm going to say some numbers, and I'd like you to just say them back to me. 92. Good. 92. 34. Great. Yes, 34. 66. Mm-hmm. 13. Great. Okay, other side. Alright. Your first number is 3. Good. It was 3. Okay. 70. Mm-hmm. 48. Great. And 51. Great, okay. Now we're just going to do some words. I'm going to say some and you just repeat them back to me. Your first word is doctor. Great, yes, okay. Your next word is examination. Good, okay. Your last word here is clipboard. Good, alright. Other side. Alright. Your first word on this side here is office. Okay. Your second word is appointment. Good. password. It is stethoscope. Great, okay. Alright, you did a great job. I didn't see any complications. We have one last test to run, and it is with my tuning fork. So it looks like this. I'm just going to give it a whack and hold it up to your ear, and you tell me when it stops, okay? Alright, here we go. Very good. Great, okay. Great, okay. 2 more times. Good. Great, okay. Well, everything checks out. You passed all of the tests today. It didn't seem like anything was of any issue or causing you discomfort, and nothing was holding you back. So, I think we are all set here. Okay? It was very nice to meet you. I hope you have a great rest of your day, and one of my nurses can help you out at the counter and checking you out, okay? Great. Thank you again. Have a good day.